Hi YouTubers, my name is Dr. Danny McClure. I'm a doctor of osteopathic medicine. And what that is compared to an MD is I have specialized training in chiropractic care in addition to the things that regular medical doctors have, and I wanted to present to you this pre-surgery video and let you know what has transpired for me and how I've made some decisions where I'm about to go through cervical disc replacement tomorrow. About 13 years ago, I had a front-end automobile accident collision and was taken to the emergency room, had numbness and tingling and pain on my right side, particularly in my thumb and my thumb, second and third digits. A CAT scan showed a bulging disc between the fifth and sixth cervical vertebrae. I saw a neurosurgeon at that time who wanted to do surgery. He wanted to fuse my cervical vertebrae together after removing that disc, and I was fairly young at the time and didn't want to have that. And so I opted for more conservative care, chiropractic care, and physical therapy. I specifically had cervical traction where basically my neck was stretched, and I responded really well to that. Over these 13 years, symptoms would kind of recur. I'd go back and have cervical traction and chiropractic care and physical therapy, and ultimately late last year, symptoms just didn't resolve at all. I had initially wanted to put off surgery for some time. I mean, who wants to have surgery, right? But I knew that cervical disc replacement devices were coming into FDA approval in the United States, so I wanted to buy some time to have that. So currently my C5, C6 disc is protruded pretty well outside, and I've got other disease now in the cervical spine area. Specifically, my third cervical vertebrae is actually pushing inward on the spinal cord itself. My symptoms are better when I lean forward in a kind of flex forward position. A lot of pain on the right side, numbness and tingling there. Left side is also involved between my shoulders, and oddly enough, over the past 6 to 9 months, I've got a lot of ringing in both ears. I don't know if that's because I'm getting older or if that's actually due to the cervical disc. I've done some medical research on the literature, and there's actually some other patients out there in some literature that would suggest that upper level C1 through 3 disease can create some problems with this ringing in the ears. Nonetheless, so as I evaluated options, for me, I did not want my two vertebrae fused together, that is with the disc removed, and then these two vertebrae basically put together with a piece of metal and screws, because it ends up making a very rigid segment, putting more strain on the disc above and below. So with me already having a lot of disc problems elsewhere, I didn't want that. Right now the data would say that every 10 years you've got a 30% chance of having a disc surgery on those discs above and below if you have that. So in 20 years it's going to be a 60% chance, in 30 years it's going to be a 90% chance. Personally, I plan on living more than 30 more years. Of course, we'll see about that. As I explored my options, the disc replacement that I personally preferred was one called M6. It's a German device. I really like it because it actually affords some cushioning between the two cervical vertebrae, and it actually, while allowing some range of motion, it actually does start to limit or restrict the range of motion when you get towards the end of the extremes of a range of motion. That's not available here in the States. Hopefully one day it may be, but it's called M6. The device I actually opted to use in discussions with my surgeon is called the Mobi-C, M-O-B-I-C. This device goes in between the two cervical vertebrae after the disc is removed, and it does allow range of motion. It does not tend to increase in resistance as you near the extension, the degree of the range of motion. It just moves. It does not afford any kind of shock absorbing, but it seems to be the best one out there. It seems to require the least surgical intervention and drilling and chiseling to get this device in. So I'm going with the Mobi-C. That surgery is in the morning. Got to be there at 5 a.m. So less than 10 hours away from having that. As I've done YouTube research, it looks like people do really well with this procedure. A small scar somewhere around the wrinkle line. So my wrinkle line, I'm wearing my t-shirt. So we'll see what that scar looks like. But as I've watched YouTube videos, people seem to do pretty well, so I hope I'll be one of those as well. I plan on shooting a video hopefully tomorrow, the day of, after my surgery, of course, and then for days and weeks and maybe even months following that. So we'll see what happens. I think I have about a week that I don't work, can't drive, and then I'll return to work with light duties, but I'm kind of restricted for about 3 months. I worry what's going to happen with a neck that doesn't move really well and lose just overall some physical fitness, and so it'll probably be a little bit of time to get back and get my strength and range of motion back. So we'll see what happens. So I just wanted to give you from a doctor's position kind of my thoughts on cervical disc replacement versus cervical vertebral fusion. And my thoughts on the Mobi-C. So stay tuned, look for some more videos coming post-surgery. Have a good evening.